Hi guys, and welcome back to Canada Top to Bottom. Today we're going to delve into a pretty big and complicated topic, Canadian healthcare, and break it down and make it as simple and easy to understand as possible.
The basics are this. Canada has a universal healthcare system funded through taxes, and every Canadian permanent resident and citizen can apply to access public health insurance. That's the simple bit. The tricky part is that each province and territory has different health plans, and they all cover slightly different services and products. One part of the healthcare system might be free in one province, but not in another. But across Canada, you generally get most healthcare services for free, and emergency medical services are provided free to virtually everyone, even those without a valid health card.
To get your hands on a health card, which is proof of your right to use Canada's healthcare system, you'll need to go to your provincial or territorial government and apply through them. Normally this can be done online, and it is a relatively simple process, provided you have all the necessary documents such as ID and proof of residency. We've put the links in the description box below to the healthcare boards for all 13 Canadian provinces and territories, so check out the relevant one for you. One thing to bear in mind is that it can take up to 3 months for your public health insurance to start after you apply for it, so you need to take out private insurance to bridge that gap. Otherwise, you'll be without coverage for a few months.
Once you're on the system, if you do have a medical emergency, then dial 911 or go to your nearest emergency room. But if you have a non-urgent medical issue, then going to a doctor is the normal route into the Canadian healthcare system. Most people here have a family doctor who they know and trust, so finding a doctor you like is one of your first jobs when you start getting your healthcare sorted out. Although, be aware that finding a family doctor who is willing to take on new patients can be pretty difficult in certain parts of Canada, so it's possible that you may not have the option to be too picky.
Recommendations are the best way of finding a family doctor, but there is a page on the Government of Canada website which will help you with the search, and we've linked to it in the description box below. Another great way of finding a doctor in your area is to join local community groups on Facebook and ask for recommendations from the local residents. This will often yield great results, with local knowledge being much more powerful than spending your day calling around every doctor in the area.
One of the most complex parts of the Canadian healthcare system is medication and how it's paid for. If you've been treated in a hospital and have a valid health card, then all of the medication used to treat you during your stay in the hospital should be covered for free. However, medication which you get over the counter from a pharmacy is not free as part of healthcare coverage, and you will have to pay for it unless you qualify for an exemption. You can get extra insurance to cover the cost of additional bills, and there are also programs specifically designed to cover the cost of medicine, but just be aware that anything prescribed by a doctor may not be part of your basic Canadian healthcare, and over-the-counter medicine almost certainly won't be provided for free.
Dental care is also not covered for free in most provinces, so most people either pay privately for it or carry add-on insurance to cover dental costs. At times there have been political moves made attempting to make dental care part of the healthcare system, but as it stands, you will more than likely have to pay extra money to get dental treatment, whether that's paying for it directly or additional insurance. A lot of employers will provide some kind of medical package within their employment offer, varying from very small contributions to full medical coverage, including dental and extras such as chiropractors, physios and osteopaths. So it's something a lot of people factor in when applying for jobs and negotiating wages.
One slightly obscure seeming but actually quite important element of the Canadian healthcare system is the medical surveillance process. If you have a history of a significant medical condition, the Government of Canada website uses active tuberculosis as an example of a serious medical condition, so we're not talking about a sore throat here, then you will be sent a medical surveillance notice form, and this form tells you that your local health authority will contact you about your condition. The local health authority will then make sure that you're registered on the correct healthcare systems and that you get the treatment that you need. If you do have a serious medical condition, the local authority will basically make sure that it doesn't go untreated and will take responsibility for getting you the help you need. One thing to be very aware of is that being in any way dishonest about serious medical conditions or simply not following the medical surveillance process can negatively affect your ability to apply for Canadian visas or citizenship. Give the information you're asked for, do as you're asked to do by the local health board, and you should receive excellent treatment.
So there you have it, Canadian healthcare in a nutshell. Basically, emergency treatment, hospital treatment including medication, visits to your local doctor and some prescription drugs are provided free for all Canadian citizens and permanent residents. Over-the-counter medicine, dental care and certain types of prescriptions are not. The easiest way to think of it is this. If you, as a Canadian PR or citizen, go to hospital and have a serious illness or injury, you will receive excellent care and all the medicine you need for free. If you have something less seriously wrong with you, you may need to pay a little extra or take out additional insurance. We hope that's cleared things up a little bit, and if it has, and if you'd like more Canada-related content every Wednesday and Sunday, then hit subscribe before you head off. See you next time.